everyone, my name is Jessica and today I'm going to be presenting the 2021 update of the CanPain SCI Clinical Practice Guidelines for Rehabilitation Management of Neuropathic Pain After Spinal Cord Injury. Neuropathic pain presents significant challenges to those living with spinal cord injury, with negative effects on function participation such as mood and sleep, and a decreased quality of life. For clinicians, providing support for those with neuropathic pain after spinal cord injury continues to be a challenge. The 2016 CanPain SCI Clinical Practice Guidelines, or CanPain SCI CPG, formalized a series of recommendations for the rehabilitation management of neuropathic pain after spinal cord injury. These guidelines were developed in accordance with the Appraisal of Guidelines for Research and Evaluation, AGREE 2 tool, and focused on screening and diagnosis, treatment, and models of care. The guidelines were updated in accordance with the AGREE 2 tool, and a steering committee and working group reviewed the relevant evidence on neuropathic pain management, encompassing screening and diagnosis, treatment, and models of care after spinal cord injury. The quality of evidence was scored using grading of recommendations assessment, development, and evaluation, or GRADE, and a consensus process was followed to achieve agreement on recommendations and clinical considerations. The working group identified and reviewed 46 additional relevant articles published since the last version of the guidelines. The panel agreed on 3 new screening and diagnosis recommendations and 8 new treatment options. 2 key changes to these treatment recommendations included the introduction of general treatment principles and a new treatment recommendation classification system. No new recommendations to model of care were made. The CanPain SCI panel made the decision to restructure the classification of treatment recommendations from first to fourth line to the current first line, B, C, and D system to account for the inherent challenges of working with a limited evidence base. An additional general recommendation regarding the pursuit of self-management strategies that those with SCI find successful was also included as a response to the limited evidence that underlies many treatment options. The CanPain SCI recommendations for the management of neuropathic pain after spinal cord injury should be used to inform practice, as these guidelines represent the most up-to-date version of the CanPain SCI CPG. As in the 2016 CPG, the primary outcome for treatment options evaluated through the GRADE process was pain intensity. The next steps for implementation of the CPG will be the refinement of existing clinical algorithms to allow easier uptake at point of care, and alternative means of disseminating the guidelines, including using a phone app, are in development. And that concludes my presentation today. Thank you, and don't hesitate to ask any questions.